Now we start with the COVID-19 situation in South Korea. After seeing the second highest daily tally of the pandemic so far on Wednesday, we've seen figures slightly come down today. But the WHO has said South Korea had the world's highest COVID-19 counts for the last 3 straight weeks. Shin Ye-eun with our top story.
South Korea on Thursday reported 395,598 new COVID-19 infections. Though this was a drop of more than 225,000 from the same time last week, the country still takes up a big portion of all the world's COVID-19 cases. In fact, the WHO said South Korea had recorded the highest number of new COVID infections in the world for 3 weeks straight. In a report on Wednesday, the global health body said the world added more than 12.3 million new cases from March 14th to 20th, which was a 7% jump from the week before. And South Korea took up more than 2.8 million of those cases, which was the largest amount of any country. Amid the uptick in COVID-19 figures, medical staff are saying that they have been pushed to the limit. While authorities have said that the current medical capacity is under control, with 30 to 40% of hospital beds still available, many in the field have said that the government's method of evaluating the country's medical capacity shouldn't be based on the number of hospital beds available for COVID-19 patients. This is because authorities have decided to transfer critically ill COVID-19 patients to regular hospital rooms after a week has passed. That's why medical staff are saying that the number of patients they're actually required to look after is much higher than the official figures.
We're trying to prevent the situation from worsening, but we're reaching a limit. Our emergency rooms have partially closed countless times. I don't know how we came this far with so many crises.
To relieve the burden on hospitals providing monitoring and phone counseling to those recovering at home and classified as the intensive management group, health authorities have decided to narrow down who's eligible for these services. From Friday, seniors age 60 and up and people with weak immunity won't be placed in the intensive management group unless they test positive through a PCR test. This means this group won't be able to receive constant monitoring or 2 daily checkups over the phone. But like others in the standard management group, they will be able to get prescription medicine after calling nearby hospitals if needed. Shin Ye-eun, Arirang News.